Obvious that it is a tax rise. It's unfair because it hits working people, particularly those on lower incomes, and it isn't going to fix the problem of social care. And I've been talking to people who are going to be hit by effectively a double whammy because on the one hand they're getting a tax rise of several £100s. At the same time, the government wants to take away the £1,000 in universal credit uplift that we've seen. So some of these families, 2.5 million families, are going to face the double whammy of losing £1,100–1,200 a year. That's a huge amount of money. It's really unfair, and we should actually spread this across those that can actually afford it.
And would you keep that social care levy? Would you keep the universal credit uplift in your next manifesto as well?
Well, the government's acting as if there's no alternative here. They're hammering working people, and we say it should be those with the broadest shoulders that should pay their fair share. So the government is saying, if you're working, we're going to tax you. And I say, well, people earn their income, they earn their money from other ways, whether it's property, landlords, stocks, shares, dividends. Those people should be paying their fair way. And the best example I can give you is this. A landlord with multiple properties doesn't pay a penny more. His or her tenants who are in work pay more tax. Nobody could argue that that's a fair way of doing this.
And on that point, I mean, the Prime Minister said that raising things like capital gains tax or kind of raising tax on profits on assets wouldn't be nearly enough money to fund social care. I mean, what evidence do you have that your alternative plans would be enough to fund social care?
I don't agree with the Prime Minister on that. Our analysis is that you could raise this money in other ways, whether that's capital gains tax, whether that's on property, stocks and shares and dividends. He's not even trying. He's gone straight for hammering working people. And last week I was speaking to Rosie, she's a care worker, and this double whammy is going to mean hundreds of pounds more for her in tax, £87 a month she's going to lose on universal credit. She's asked for more shifts, she can't get them. She's got childcare issues. It's people like Rosie, care workers, retail workers, hospitality workers, who are getting hammered by this government.
And on universal credit, would you keep that uplift permanently? Is that something you'd put in your next manifesto?
We've been fighting the government on this uplift month in, month out. It is wrong to remove that £1,000 uplift. It'll impact millions of families who'll be poorer because of it. In the long run, we would reform and change universal credit because it doesn't work well, particularly when people start to want to earn a little bit more money. They get trapped in the system. So we'd reform it in the long run, but absolutely keep this uplift at the moment. It's a lifeline for millions of families.
And what about the social care levy that the government is introducing? Is that something you would keep to fund social care long term?
We think there's an alternative, which is to fund this in a broader way where those with the broadest shoulders pay their fair share, and to put all of the burden on working people is wrong, it's unfair. And the thing about this tax is it's a tax rise. It's unfair because it hammers working people and it's not going to fix the problem. We don't even know when this money is actually going to be paid on social care at all, and it only addresses one small part of the problem, which is whether people have to sell their homes. Many people with moderate homes will still have to sell their homes. The much bigger questions of providing care for people in their own homes, paying the workforce properly, are left completely unaddressed by this.
And you've been under some pressure to sort of provide specific plans about your alternative. I mean, how much would your alternative plans raise, do you think? And also, when are we going to see your specific plans for social care reform? The
principles are very clear, so let me set them out. Firstly, we must make sure that care is provided at home. The vast majority of people want their care provided at home. So the question of going into a care home is secondary. The first question is provided at home. The second principle under our plan is that this should be preventative. There are many bits of social care which aren't provided at the moment. If they were, it would actually prevent people going into care homes in the long run. And the third issue that's really important to our plan, our principles, is that you've got to pay the workforce properly. Care workers are underpaid and undervalued, and we want to see that change, and change materially by them being paid more on more secure contracts, and recognised for the hard work that they put in. So they're the principles of the plan that we put forward.
And just financially as well, do you agree with any kind of caps on care costs like the ones that the government have introduced? What would you do differently?
Well, nobody, I think, likes to see people forced to sell their homes in order to fund their care. The problem with the government's plan is it's not going to address that problem, because if you've got a home that's worth, let's say, about £160,000, which would be an average across the country, then you're still going to get hit for the £86,000 to pay towards your care. And most people are not going to be able to find £86,000 without selling their home. People don't have that kind of money. And so, yes, address the problem, but not with this unfair way that the government's put forward.
And just finally on this topic, when might we see a sort of fully costed plan that Labour would put forward as an alternative option?
Well, the principles are, as I say, out there and very clear. Home first is the first principle that we would have in our plan. Preventative is the second principle in the plan, so that we prevent the problems as they arise and prevent them getting worse. And then thirdly, on the workforce and how we improve the terms and conditions of care workers in particular. Quite a lot of that we set out over the summer when we were dealing with workplace rights.
And just moving on to COVID now, as we head into the winter, I mean, do you agree with the government getting rid of some of the COVID restrictions, like the fact that they've signalled they're very keen to get rid of PCR tests for double vax travellers as soon as possible? Do you think that should be going as we head into winter?
I think everybody wants to see restrictions lifted as best we can. But we've got to be cautious, because for everybody who says to me, I want the restrictions lifted, they also say, understandably, but I don't want to go back into another lockdown. Nobody wants that. So what we've said is follow the science, be careful, be cautious, and make sure that whatever we do, we don't go back into another lockdown.
Do you agree on that point about PCR tests? I mean, the government have said that they are an unfair cost on families who want to go away. Would you like to see them scrapped as well?
I think some of the costs have been far too high for the PCR tests, but I don't want to get rid of the idea that tests should be available to people who need them. Now, travelling is one aspect of this, but what is vitally important, I think, is that we have free tests in our communities so that people can get tested, they know when they have to isolate, and we can get the virus under control, because the most important thing is that now we have opened up to a degree that we don't go back into lockdown.
Would you agree with do you agree with the government's plans as well to not push forward with COVID vaccine passports in England? Do you think that's the right decision?
Well, the government's plans change all of the time. Over the last 6 months, we've had any number of plans on vaccine passports. Last few days, we've seen the government's position change. I think that vaccine passports should never prevent people getting essential services, health, dentistry, the sort of everyday essentials that people need. So shouldn't stop people getting those essentials. Possibly for some events they could be used in conjunction with tests, but never on their own. So it should always be an alternative, either a double vaccination or a negative test. But as I say, the most important thing is that we shouldn't see vaccine passports stopping people get what is essential.